Me.
Okay, first question. Should the Affordable Care Act, otherwise known as Obamacare, be repealed?
Firstly, I'm an advocate for single payer. So let's just get that out first and foremost. If we remember when the Affordable Care Act was being pushed through Congress, and it was pushed through Congress, we weren't in a good place when it came to acquiring health insurance for millions of Americans. If you had a pre-existing condition, you couldn't get covered. If you were really sick or had a child that was really sick, you dealt with lifetime caps. Women were being charged more than men for insurance, and not just in the childbearing years, right? A 50-year-old woman was being charged more than a 50-year-old man. And most of women's health diagnostic care was not necessarily a covered procedure. The Affordable Care Act fixed many of these things, and for that I am grateful. More women are now getting mammograms because they're considered a covered diagnostic exam and they don't have to pull $300 out of their pocket for a copay. More kids are getting physicals. More women are getting physicals because they're covered. However, the Affordable Care Act handed a whole new crop of customers to our insurance companies. And we have insurance companies that are experiencing double-digit profits that are choosing to come out of the exchanges because it doesn't make them enough money. So I would not argue that this served us, but a repeal with nothing to replace it, I think is short-sighted, because there are 20 million Americans that now have insurance that wouldn't. There are millions of women that are getting mammograms that otherwise wouldn't be. There are children that are getting vaccines and physicals covered. So, Medicare has an overhead rate of 6%, and it works. So I would be a proponent for a single payer, fixing what's broken about the Affordable Care Act, that's a monumental task, but I would be going a direction of making sure that everyone has coverage from cradle to grave. Thank you.
I actually have voted to repeal and replace the Affordable Care Act. The Affordable Care Act was, as Kerith mentioned, was pushed through, was rushed through. It was one-dimensional. There was no opportunity for input. And I actually thought that I came to Washington after serving 28 years in providing health care to individuals facing life-changing disease and disability. I knew we could improve our system. And I was kind of excited when they were talking about health care. But then I got locked out of the room. It wasn't just me, it was my Democratic friends too that got locked out of the room, rank and file. We need to repeal and we need to replace. The bill is not the same bill we started on. I've supported probably somewhere in the neighborhood of 50 changes to the bill that the President has agreed to. Well, the Senate agreed to first, and then the President signed in. It notably has been flawed, very flawed. But there's so much more that needs to be done, and I'm not sure that without repealing and replacing it, it's going to have to be almost simultaneously. Premiums, the average healthcare premiums have gone up $3,775. There was a promise it was going to be reduced. For those folks who have health care for the first time, and I'm happy that they have it, but their deductibles are so much, and yes, they get wellness services, and that's incredibly important, prevention. That should be a part of anything we do in health care. But if you can't afford the deductibles, you can't afford to get sick. Because some of those deductibles are $3,000, $5,000, $7,000 per family member. If you like kids having access to care, they took kids out of CHIP and put them into medical assistance where most physicians are no longer accepting in more patients. Thank you.